Good morning, everyone. This is Lori DeToro from Fluke Excelix. Thank you for joining us for this month's Best Practice webinar. As software and sensor providers, we offer an array of webinars and other education, including product demos and product training. Our Best Practice webinar series focuses not on our technology and software, but on maintenance strategies and solutions with speakers from a variety of backgrounds to share their knowledge. We are really pleased to have with us today Dr. Jake Mazulovich, owner and principal of JMA Human Error Solutions, who will be presenting 3 practical strategies for managing preventable errors in the workplace. And funnily enough, we experienced a little human error this morning with some of our webinar technology, and we're looking into it, but just want you to be aware of it. So if you experience any problems during the presentation today, please let us know. Good morning, Jake. Thank you so much for joining us today.
Good morning, Lori. Thanks very much for having me on the show.
Absolutely. Before you get started with your presentation, I want to talk a little bit about how I met you. I saw you presenting on this topic at MarCon this year in Knoxville, Tennessee, and definitely thought this would be a great thing to bring to our audience. And we're also excited that you will be giving one of our keynotes during Accelerate 18 in November today around this topic, and wanted to ask you why you're so passionate about preventing errors in the workplace and the topic that you're speaking on today.
Well, I started off a long time ago in training, in technical training, and what I noticed was no matter how well we train people, and no matter kind of what people's intentions are, even the most experienced people, from basic trainees to 30-year veteran employees in virtually every industry, make mistakes, and the way that people handle making errors or making mistakes varies widely, you might say wildly. And I got more and more fascinated with how people respond to errors. And I realized that because I've got the PhD, but it's not in electrical engineering, it's in education. I realized that basically I knew a lot and had done already a lot of research on helping people learn from mistakes, helping people make better decisions, and helping people communicate better. And those 3 things I realized when I was going through my PhD, I didn't know anything about human performance. But when I got into kind of the industrial world, I realized they don't necessarily need a PhD in education, talking about for John Dewey or stuff, for example, but they really do need good, practical, applied psychology, evidence-based, field-tested strategies and practices to help people minimize errors, learn from errors, and mitigate errors on the team and the individual and the organizational level. So I wound up in this thing called human performance and realized that I'd kind of been doing this human performance stuff all of my life. I just wasn't quite sure what it had been called. I didn't know that it had been called this in this particular industry. So I was new into it, but then realized I've known tons about this for a long time. So it was kind of an interesting fit.
That's really awesome. And like I said, we're happy to have you here today. And before you begin your presentation, we want to take care of a few housekeeping items. The session is being recorded, so attendees will not be able to verbally ask questions, but of course you can type in your questions and comments at any time. There's a GoToWebinar feature where you can do that. I will ask Jake these questions at the end of his presentation for as much time as we have for Q&A. We will not be sharing the whole PowerPoint presentation for this webinar, but if you'd like to receive a one-page summary of the presentation today, you can let us know when the survey comes up at the end of the webinar. The recorded webinar will be available on excelix.com/community for you to view. And I think that's it. We're looking forward to it. And Dr. Jake, let's get started.
Sounds great. Hello, everybody. I'm looking at, looks like 74, 75 people out there. Hope you're all doing well today. Let's jump into, let me give you a little bit of background on me because I'm not necessarily from your industry. I worked a lot in the electric utility industry, but my background is kind of crazy. I'd rather show it to you visually, just give you a little bit of background. I was a firefighter for about 3 years, volunteer firefighter. I was an EMT, emergency medical technician, on a paid service for a couple of years. Lower left-hand corner there, I was a SAR, search and rescue, volunteer wilderness search and rescue field team leader. And yeah, top right-hand corner, I actually did jump out of perfectly good airplanes for the military for a while, Army National Guard. And you ask any paratrooper, why do you jump out of, perfectly good airplanes? Our standard answer is there's no such thing as a perfectly good airplane. I can always find something wrong with it. But I learned through all of those experiences a lot about high performance teams, high reliability teams, trusting my life to procedures that are different from the ones that a lineman trust their lives to, things like that, but I would say they're equivalent. We used to say when rigging a parachute, putting on the parachute and getting everything right, we used to say if it's 99% right, then it's wrong. Meaning it's black and white. You've got to have it 100% right or you didn't do it right. So I learned a lot about high reliability and minimizing errors. I learned a lot of strategies and tricks, you might call them Jedi mind tricks, for reducing errors and preventing errors in these 4 things. And then when I got to here, I started working for Dominion Energy, East Coast, Virginia, North Carolina, a couple million customers. I was in charge of doing human performance for about a 3,600 person business unit. And that included distribution linemen, transmission linemen, substation operators, relay technicians, system operators up there in the top right-hand corner. Those are basically the air traffic controllers of the electric industry. They sit in the big comfortable rooms like mission control, and they can turn off any substation or all of them, at the click of a button. So a lot of power, a lot of chances to make mistakes. And yeah, I did get to go for a ride in the big bucket truck, the Condor, down there about 150 feet. And no, they wouldn't let me drive it, but I did ask. Hey, so you try, you see what you can do. Once I got into there and I was researching and training and teaching and advising everybody up through the executive level, vice presidents, on how to reduce and mitigate human errors, I started to be able to put some words, some concepts, some theory, and link that to some of the practices that I've been doing for 20 or 30 years. What I want to give to you today in about the next 30 minutes or so are basically 3 big strategies for preventing and reducing and mitigating human errors. But before I jump into that, let's hear a little bit from you all about how bad you think the problem is. Here's a couple of quiz slides, and here's the first one. How much do the top 500 or so businesses in the US and the UK spend on workplace errors every year? And your answers are below. And Lori, if you want to switch to the polling slide, let's see what
I
people...
will. We have everyone answering questions, so I will give everyone a few seconds to weigh in, and then we'll push the results out. And the spread of choices there. We've got almost 70% have responded, so we will, and now 70%. So we'll close out the poll.
Right.
And share the results. And the winner was 37% said 3.7 billion, 33% said 37 billion. Right. And then there was an even split of almost even 14 and 16 for 370. So the top 2 answers were 3.7, which was top, and 37 billion.
I'm looking at, it's interesting, almost like a bell curve. You got the real optimists going, no, it's not that much, and the real cynics at the end going, no, it's way higher than we think. So I love having those folks in class. So the real answer is the suspense getting to you yet? Okay, all right, we'll go ahead and change it. We're going to try to change it. There we go. It's actually about $37 billion. And if you want to go look it up, here's the link right on the bottom. Don't believe me. This was in Risk Management magazine, basically for risk managers. What they did was probably a multi-year study, maybe a year-long study by a group called IDG that basically studied what they called misunderstandings in the US and the UK. Now, keep in mind, this is only about the top 500 companies in both the US and the UK. So these are big companies big enough that can afford to hire, a human performance department or a specialist like me to help out. This doesn't even count the smaller companies, the mom and pop stores or small businesses that can't afford somebody like that. So I would suggest that the number spent total on errors and misunderstandings is a whole lot higher than that. So That's one idea of how bad the problem is. Let's take another look. Here's one example of what human errors can do, human and organizational errors. Back in 2003 in August, there was the Big Northeast Blackout. Now, it started when overgrown trees tripped a transmission line up in Ohio, but if that's the short version of the story, I was actually able to talk with some of the contractors who worked on that, and they said, Jake, off the record, and you can't go telling all this on your webinars and stuff, but you want to know what really happened? And I said, yeah. And what they told me was it's a lot more complicated than just overgrown trees. Once that incident started, errors and miscommunications basically multiplied the effect, made things a lot worse rather than fixing it, created what we call a cascade, wound up with about 60 million people without power for about 2 days. And that one, I don't believe we have a slide on that one, Lori, or a polling slide on that one, correct?
No, we don't.
Okay, so that one, you can just kind of go mentally, what do you imagine that's going to cost? The actual cost, and this is substantiated in a research study, and this is basically just direct costs, it's about $6 billion. So there are dozens, probably hundreds of incidents like this that you can look up on the internet about incidents that have happened globally or in specific industries that have all come or been triggered by human and organizational errors. Even medicine, right? When we go into a hospital, we like to think, man, now you're in a hospital, you're safe. Well, hospital had, or basically the healthcare industry, thought that they were immune to that, or seemed to articulate that in some ways, like, well, we can't afford to make mistakes, or they train doctors, you just don't make mistakes. Of course they do, nurses do. Everybody makes mistakes, even in healthcare, and sometimes those mistakes result in deaths. So in about the year 1999, the National Academy of Sciences did a long study and figured out and estimated as well as they could how many people die from medical errors in US hospitals. So Lori, could you put up the polling slide and let's see what people think on that?
I will. We're launching it now. Please weigh in with your answers. And as in the past, we will give you about 30 seconds to weigh in. And hopefully we'll get about a little more than half of you to answer for us. There are no punishment or anything for wrong answers. Okay, so we are close to having about 70% answer. So we're going to close the poll and we will share the results.
Okay.
And 52% said 44,000. 28% said 440,000. 15% said 4,400, and only 5% said 4.4 million. So those are the answers.
The real cynics may have stepped out for a fresh cup of tea or coffee or something. So, and that's okay. So the real answer for this one is, I'm sorry, I had changed, that one I had changed a little bit, updated that. The first study that came out, which was in 1999, basically said the number is between 44,000 and 98,000 people every year. 44,000 and 98, basically, 50,000 to 100,000 people dying every year. And that was the wake-up call for the medical industry, the healthcare industry. Every industry that has woken up to the idea of human error and actively manages human error has pretty much had a wake-up call at some point. The nuclear industry, which has had a pretty stellar safety record, got its wake-up call in 1979. And if you're studied history a little bit, you're going to know what that was in 3 Mile Island. That was the event that made the nuclear industry go, wow, close enough isn't close enough. The chemical industry got its wake-up call in a small city in India called Bhopal in 1984. The commercial airline industry got its wake-up call, and this is kind of going in the Wayback Machine. I don't know if there are any pilots out there. Go ahead and Google after the presentation a little island off the west coast of Africa called Tenerife. That's where 583, 581, I believe, people died within a few minutes because two fully loaded 747s crashed. That's the worst, still even today, the worst aviation accident in aviation history. So all of those events were watershed events that made those respective industries say, we can't just say air is a part of doing business and we'll just try to do our best or try to pay more attention. We've got to do something different than that. So now that we've finished up with kind of the morbid statistics, let's get on with the good news. All right, is there any good news? Yeah, it turns out a lot of it. What industry, and we don't have a poll on this, but just think to yourself, what industry would you say is the gold standard managing errors? Nobody is perfect, right? No industry is perfect, but probably more than anybody else, this industry has a stellar safety record over going back decades. And also, it's not just stellar safety, but reliability as well. The answer, what I would say, is aviation. And here's a couple of statistics to let you know. As we used to say, jumping out of airplanes, your most dangerous part of your whole adventure, if you're going on a flight, the most dangerous thing is driving to the airport. Flying is about 19 times safer than driving. Chance of dying from, for example, heart disease in this country is extremely high. Some version of heart disease, 50%. Your chances of dying on commercial aviation is about 100,000th of 1%. So just almost unbelievably safer. You are really more likely to die from a bee sting than on aviation. And keep that in mind, you're flying it, when you're in one of these things, you're flying at 450 miles an hour, 30,000 feet. The temperature outside is 30, 50, 70 degrees below zero, right? With all of those risk factors going into it, I'm willing to bet that the biggest question that you have when you board one of these monsters is, do they have Wi-Fi on here? Aviation, in short, has basically made one of the most high-risk industries in history boring. And they haven't done it just because they've picked good people. Certainly they do pick good people, but I'm going to show you some of the ways that aviation has become kind of the gold standard. And it's not just aviation, but they tend to use all three of these strategies of HPI, human performance improvement. Okay, so here's the first strategy to jump into it, applying defenses. And when I say applying defenses, what I mean are the classic individual and team defenses. Now, you all probably know some of these. You may not know all of them. Things like three-step communication, pre-job briefing, flagging, phonetic alphabet, Alpha, Bravo, Charlie, things like that. Self-check, which is stop, think, act, review, or as a good electrical lineman in Georgia put it to me, he said, shoot, that ain't right. I'm like, STAR, wait, shoot, that ain't right. And he didn't say shoot either, by the way. But either acronym you use, right? Stop, think, act, review, or shoot, that ain't right. Either one is fine. You got self-check. Placekeeping. Checklist is good. Peer check. Situational awareness. Touch or point. Stop when unsure. Questioning attitude. These are two that I've underlined, confirm terminology and communicate before each irreversible step. I certainly wouldn't be arrogant enough to say that I invented those, but I've never seen them written up in any of the documents or reference guides that have any of these other tools in them. I've used confirm terminology and communicate before each irreversible step in the military, in the fire and rescue service, and use it, regularly now. In my little handbook, which I'll tell you about a little bit later, it's part of the workshop that I give, I actually include those in it and teach them. So different industries have very different classic individual and team tools, but there's some ones that go across industries. These are some good ones. To get these, and you may be asking yourself, great, Jake, where can I learn more about these? Here's the best source I'm going to give you. It's actually courtesy of your government, U.S. Department of Energy Human Performance Improvement Manuals. You can just look at them online. They are, because they're from the DOE, not only are they free and accessible, they are public domain, which means you can basically cut and paste almost anything out of it. Don't take my word, you double check and read the fine print, but basically you can cut and paste almost anything out of it and use it because it comes from government sources. And many, many, many companies have. They were published in about 2009, and I actually just got tapped to help help with the project to ultimately rewrite these manuals as well. So that's going to be a longer process. We just finished up redeveloping new human performance training for the Department of Energy, but this will be part of it. Anyway, those are two ways, those are the two volumes. You want volume number 2. It's about 150 pages of all the classic tools. Moving along pretty quickly, here's the core problem. If all you do is say, well, all we need, Jake, is a couple of checklists and we're going to do a few peer checks, 3-way communication, that's it, that's all we need. Here's what I fear you're going to run into, because I've seen it dozens of times. If you allow the defenses to become your entire HPI program within a few months, maybe a few years, here's what's going to happen. Leaders are going to start requiring use of the defenses, right? Makes sense. If a little bit of 3-way communication is good, then a lot of it is better. We're going to require people to use it. Once that happens, this happens. Within a couple months or a couple years, leaders are going to start framing every incident, every accident, every time something goes wrong, they're going to frame it as a failure to apply the defenses. Billy, listen, you rolled a bucket truck, so you must have lost situation awareness. It's your fault. Megan, listen, you were doing a switching order in a substation. You threw the wrong 1-0 switch. You must not have gotten a good peer check. Your fault. You see the common punchline to all those? So once that happens, this happens. Many of the workers wind up going, oh, I get it. Now I know what this HPI stuff is really about. It's just another way to hold me accountable. And once that happens, they go, I don't want any part of it. I will comply, but I'm going to sandbag. I'm just not going to do anything other than what I need to, because it's just basically a tool to punish me. And once that happens, this happens. Leaders wind up saying, you know, we tried this HPI stuff, but maybe it works for aviation and the military and fire and rescue, but it just doesn't work for us. And then it becomes another flavor of the month. That's something that I've seen happen over and over and over and over again. And it's not anybody's fault. It's just people with the best intentions, including the leaders, don't wind up looking at the long term. They wind up looking at the short term. All right, so you're saying, well, great, Jake, if the defenses that you just told us about don't work, and that's not true, they do work, but you can't depend on just those defenses. You can't have just one strategy. So what's the second? What's a more advanced strategy of HPI other than the defenses? Well, here's a quote from James Reason that I liked. Rather than being the main instigators of an accident, operators tend to be the inheritors of system defects created by poor design, incorrect installation, faulty maintenance, and bad management decisions. Their part is usually that of adding the final garnish to a lethal brew whose ingredients have already been long in the cooking. He said that back in 1990. So instead of finding where human beings went wrong, try to change, this is what Reason says, and this is kind of the second strategy, try to change the system that people work in. All right, so let's take a practical example. How many of you all remember when you could take a 2000 PSI tool and connect it to a 10,000 PSI power source, right? The hose ends were the same, the fittings were the same, and you just had to be careful not to connect those two, because if you've ever done that before, you know it will ruin your day. So now, we don't tell people, hey, make sure, be careful you don't connect the wrong system. Hey, get a peer check. Make sure you don't connect a 2K PSI tool to a 10K system. We don't just do a checklist for that. What do? How did we solve that problem? We changed the fittings. We had enough incidents, enough accidents, even with really good experienced people, 30-year veterans, that we wound up saying, look, let's make a 2000 PSI fitting one type of fitting and a 10,000 PSI fitting a completely different one. You could be a gorilla and you're never going to be able to put those two hoses together because they're not designed to go together. Once we made that design change, that system change, errors dropped instantly, dramatically, and permanently. That's a system change. So a question for you all, and I'm just curious, I don't know if, Lori, if they can put up their hands or not, and that's okay if they can't, don't worry about it. I'm just curious, pretend you can put up your hand or go ahead and do it. How many of you used a step ladder? And I mean just a regular 6-foot folding step ladder. How many of you all have used one of those recently, you know, within the past month?
I think most people have, Jake. I'm guessing most people have.
So here's what so you know the OSHA rule, which is don't stop on the don't step on the top 2 steps, right? So a traditional solution for that would be do a peer check for that. Hey, have a partner who's going to make sure you don't step on that. Put a big warning sign on it, skull and crossbones, don't step on this step, something like that. But a friend of mine actually showed up at my house one time to help me out with something, and he brought over this. It's a design change, right? Instead of trying to change human beings to not step on the top step, which most everybody does, we changed the design, right? So that it's virtually impossible to step on the top step. I say virtually because when I show this to a group of field folks, which I almost always do, there's usually one guy in the back who's sitting with his baseball cap pulled down and he's looking at it and he's got his arms crossed and he said, I could get on that top step. And I'm like, okay, those are my favorite people in class. They're great. You got to be careful though. So I usually have a one-on-one conversation with him, but that's it. So that's a design change, right? There's no remedy to be found in selecting heroes nor in seeking Superman. Tomorrow, like today, we're going to be human. The remedy is in changing the systems of work. The remedy is in design. And that's from Don Berwick, President and CEO of the Institute for Healthcare Improvement. This is, Berwick is one of the top patient safety advocates and advocates for basically reducing deaths and errors in hospitals and is one of the foremost people in the nation, if not the world, on that. So the second defense, or the second strategy rather, is improve your processes, improve your systems, instead of trying to change the humans that are in the systems. But there's a problem with that strategy as well, right? Nothing is perfect. If it was, I would have shown you this strategy first. Here's the second problem, or the core problem with this strategy. Some jobs are so complex that they can't really be codified into a process. They can't be proceduralized. I would be willing to bet that many of you know or do some jobs that if I just said, listen, take a week, take all the time you need, but I want you to put it down into a flow chart and make it into a step-by-step procedure that anybody could follow, even if you had a month or a year to do it, you probably couldn't do it for some jobs because they're just simply too complex. There's too many variables. There's too many if-thens into it. One example might be troubleshooting an electrical system. Installing one, that maybe is more step-by-step, but troubleshooting, figuring out what's wrong, that's more, well, what do you do next? It depends, right? So what's the third step? What's the third stage or the third strategy of human performance? And this is where the really advanced companies come in, really advanced organizations and teams. We might call them high reliability organizations. Back in the 1970s, researchers out in California were starting to see the advent of globalization. They were seeing the advent of computerization, that they knew that was coming, even though it wasn't there yet. And they just said, look, in the next 20, 30, 40 years, our lives, our mechanisms, our industries, whatever industry you're in, is going to be getting more complex. We're going to be making a lot more errors because everything is getting more interdependent, right? And so there've got to be ways that we can do this and reduce the amount of errors and make things more reliable. So they're researchers, right? So they went and said, well, what are the existing high reliability organizations? Let's pick 4 or 5 that are basically extremely reliable, not perfect, nobody's perfect, but extremely reliable year in and year out over years and years and decades and decades. And they picked 5 organizations. They picked the flight decks, or the deck crews rather, on aircraft carriers. They picked the operating systems of, or the operation rooms of nuclear power plants. They picked the system operation rooms of big electrical companies. They picked wilderness firefighters, believe it or not, out in the Midwest, the smoke jumpers, the hot shots, folks like that. And they picked air traffic controllers. All 5 of those groups, very different industries, very different environments they work in, but all of them are what they originally called high reliability organizations. And so for about 30 years, researchers have been studying these HROs, high reliability organizations, to figure out what is it that they're doing that the rest of us kind of normal mortal people can try to do as well. And they've come up with a couple of really cool things. Here's one example. So here's a question. How many errors does this key on your computer, if you don't have a key, you have a keystroke for it, how many errors does this prevent? If you said a lot, think again. This key doesn't prevent any errors, right? The strategies, the classic and individual and team defenses, they definitely prevent errors, but this key doesn't prevent errors. It allows you to recover from errors and learn from them without being destroyed by them. See, the folks who were designing computers in the modern age, they said, we're going to have a lot of, 20-something guys and women and teenagers, guys and women, programming code, staying up late in the middle of the night, eating pizza, drinking Mountain Dew, writing tens of thousands of lines of code, and they're going to delete some by accident. How do we get these, 20-something folks to not delete things or not make mistakes? And they eventually came up with, we're not. They're going to make mistakes. You cannot prevent programmers, even experienced ones, from making mistakes like this. So what they did was completely shift their thinking to saying, okay, once we eliminate the basic mistakes, the repetitive mistakes, the design-based mistakes, we're going to be left with humans being humans. How can we allow humans to be humans and learn from their mistakes, which is how humans naturally learn? And what technologies can we build in that allow people not to not make mistakes, but to allow people to be resilient, to come back, to bounce back from mistakes easily? And they started thinking of them, and that's one example. That's a strategy, resilience, that we all use all the time. Another example would be the photo in the slide ahead of you, the seatbelt. How many driving errors do seatbelts prevent? None. Same thing as the undo key. But what seatbelts do is allow the errors that you do make when you're driving to be survivable and learnable instead of deadly. That's why we have seatbelts. So the third strategy of resilience is really a big mind shift. It may not seem that way right now, but it's a huge mind shift. It's saying instead of errors being bad, errors are natural. They're going to be part of your life. You can't get away from them. So stop demonizing errors and learn from them. Just put in technologies and systems and basically make your culture so that it's okay and acceptable to learn from mistakes and don't demonize them. Here's another example, GFCI outlet. When they said, how can we get people to stop driving a hair dryer that's turned on into a bathtub? Because that's obviously really dangerous. The answer was they can't. But let's build something in that's essentially allows people to fail safely. And we call them failsafes, right? The undo key is a failsafe. GFCI outlet is a failsafe. How many of you all are woodworkers, right? Build cabinets or fun little doodads and stuff out of wood at home. It's neat. I used to do it. If you do, you might have a table saw, right? It's one of the more popular tools. It's also one of the most dangerous tools you can possibly have in your house. That blade is pretty sharp and it rotates at about 5,000 RPM. So for a long time, people put their fingers into those blades unknowingly, right? Just not thinking, slip for just a moment, and they lost their fingers. In fact, I think the industry is something like they sell about $2 million worth of table saws every year, the industry does, but emergency rooms do about 4 or 5, maybe $6 million worth of injury surgeries and stuff to correct incidents by this. So instead of saying, how can we stop people from putting their fingers into a saw, some guy, a guy named Steve Gass, who was a lifelong woodworker, came up with something called Saw Stop. And you can go video it now or go Google it afterwards. He basically came up with a way so that you can have that saw on at full power, right? And you can actually put your finger into the saw blade. You can touch your finger to that rotating blade at 5,000 RPM, and you will walk away with a little scratch, and it won't even draw blood. Now it destroys the saw in the process, but at that point, the saw is not your problem. Anyway, once people who have started using that design, that fail-safe, realized that errors where fingers were getting lopped off dropped instantly, dramatically, and as long as you use the system permanently. It's another great example of a fail-safe. So most of you all may say, great, and you work with some technical systems. Maybe some of you all are already coming up with ideas of, hey, here's a fail-safe that I can build into some of the systems that I work with, and that's great. Medical device manufacturers do that all the time. Building in fail-safes is a great idea. But a lot of folks realize that even though we work with technology, most of the errors that we have are people-based. They're human-based, not technology-based. And so an undo key or a saw stop isn't going to prevent the big problems. So here's what the research says about applying resilience in human-based systems. Think of 3 big strategies, okay? One is sharing expertise. Educators would say that the tacit always leads the explicit, meaning what we do, that we just know how to do it, that always exceeds our ability to explain what we're doing. And if you think about it, take an expert who's at the top of their game and really did a great job on one project and ask them, tell me exactly why you made all the significant decisions that you made. Chances are they can explain some, but they won't be able to explain all of them, right? The tacit always leads the explicit. And so one of the best ways researchers have found to make a team more resilient is to have them share expertise, significantly, relentlessly, institutionally sharing expertise. And that just means baking in time, protected time for experts to share the stories of what they do with each other, because in those stories, there's a lot of wisdom that really cannot be distilled or extracted into a training manual or a procedure. The good companies and high reliability organizations know this, and they use some techniques, one of which I teach. It's very popular, called an after action review. And all it does is, after a job is finished, you sit down with whoever is on the job and you ask 4 questions. The questions are, number 1, what did we set out to do? Number 2, what did we actually do? Number 3, why did it turn out this way? And number 4, what are we going to do different? And those 4 questions have been honed and sharpened and refined over about the past 30 years or so, since they were originally invented at one of the officer training groups for the US military, right? So I train people how to use those questions to share expertise all the time. The second strategy of building resilience in a person-based team, a human-based team, as opposed to a technological environment, is banking resources. When something goes wrong, you got to have the spare parts, the spare money, the training ready to go at a moment's notice. Extra staff that you can that's on an on-call list, things like that. For example, practical question: how many of you all have done CPR training? Right, you've got your CPR cards, an active current CPR card, right? And that may be, let's say that's 50 people. But how many of you have actually ever done CPR on somebody? I'm betting that might be some, but a pretty small number, maybe 5 people. Well, does that mean that, 95 people out of 100 who didn't do the CPR, did you waste the CPR training? No, because you know that if you ever get called on to do CPR, you can't pull up an app and say, wait a minute, I'm just going to get some skill on how to do CPR now. You have to have had that training banked as a resource in reserve so that it's there exactly the moment that you need it. High reliability teams put a lot of effort into banking resources, not just spare parts, but also training, things like that. And the third one is practicing resilience. It's been said about the military before that you fight how you train. And so another way of putting this is a general a long time ago from Europe had came over and was working with the American military for a while. And he said, the Americans are really good at war because war is chaos. And nobody practices chaos on a daily basis like the Americans do. That was sort of a backhanded compliment, but we took it in stride, and it's true. We do practice chaos, and practicing resilience basically means practicing controlled chaos in a way that you can learn how to come back from something, an incident, when something goes wrong. For example, you all do fire drills. In buildings that you work in, you do fire drills. That's a way of practicing resilience, but for most people, a fire drill is just kind of an administrative burden. It's not actually practicing anything. Imagine if the next time you heard the fire drill announcement go off and you kind of walked out your route, you saw a big piece of yellow tape over the door usually go out and said, this door is blocked by fire. Don't use it. what would you do? And there's no sign telling you where to go or what to do. That is more practicing resilience, because you have to think and adapt and figure out what to do when something goes wrong. Folks in military and fire and rescue practice this kind of resilience all the time. Yeah, they practice things going right, but they also practice things going wrong and how to handle them. And as a result, when things really do go wrong, it really doesn't even bump them offline very much. So those are the three ways, those are the three big strategies to apply resilience. A good way to put it is this, and this is a book, if you're interested in this, I've got some good resources on my website that you might, including a big reading list, but this is one book that if you're interested in HROs, you should look up. Wyke and Sutcliffe, Managing the Unexpected. One of their quotes is, the hallmark of a high reliability organization, it's not that it's error-free, but that errors don't disable it. And that's a good summary of what HROs do. So that's the kind of a summary of the third strategy of human performance, of applying resilience. So those are the three strategies: applying classic individual and team defenses. Number two is improving processes. And number three is building resilience. And we'll take questions in just a minute. If you liked that, if you found that interesting and found it useful, you may also find this useful. Most of the time when I teach this, it's live, and I've handed out these books to people. It's about a 54-page book, 24 of the best human performance strategies and ideas in it that might be useful to you. They're available on my website. It's the only place they're available. Can't get them on Amazon.com. And they're pretty useful. It's the textbook that I use basically in all of my workshops. And the last little bit there, if you liked, again, what you heard, number one, go to the website. There's some great links to books there, articles, resources, even a video or two that might be, they'll feed your rat for human performance. They'll give you all the readings that you want. And if you want any more or curious about something that's not on the site, like, for example, crew resource management from aviation, just shoot me an email and I'll tell you the best resource that I know about it. Second idea is order the handbooks. Obviously, those are there, very useful. I just shipped out a couple of hundred about a week ago. And the third one, I'll shamelessly mention, I do workshops. That is the main thing that I do, go around the country, mostly East Coast and Midwest, and basically give 1- and 2-day workshops, always interactive with leaders. And we go into a lot more details and examples about these three strategies and how you can apply them to your work. And with that, that's kind of what I wanted to tell you. I've been talking for a long time, and that's longer than I ever like to talk. I'm curious to hear what questions you come up with in the next couple minutes. So hit me with some questions.
Well, Jake, thank you so much. That was a great presentation and very informative. And thanks for mentioning your handbook. I got one of those at MarCon and really have enjoyed reading through that. And like I said, your presentation definitely, prompted me to ask you to present with us here today. One comment that that goes along with the resiliency that one of our attendees had was that they gather reliability professionals monthly on a conference call. And most months we share best practices to ensure reliability of a particular equipment class. Motors was this morning. In the past, they've done pumps, refrigeration machines, piping, and air handling systems. So that's definitely a good way to go, I would expect, to help build that resilience that you're talking about.
Definitely. Anytime that you can get experts together sharing as peers. So it's not a training where experts are, sitting in a room learning from somebody else. So that's nice. And we're doing that in some way here. But the more you can get peer to peer, Lori, it's like we said kind of in the beginning before the webinar got started, dialogue is always more interesting and usually more effective than monologue. So what I like to do are what I'll call semi-structured conversations. You don't just throw a bunch of experts into a room and say, well, talk. That's not structured enough. But you don't just say, well, here's the 15-point agenda and I'll tell you when to speak up. You don't do that either. It's got to be semi-structured, kind of like the after-action review questions. That's when there's some flow to the conversation, but there's plenty of room for experts to say things like, I just noticed something about the T-471, and here's what I'm thinking. And 3 other people say, I had never thought of that before, but we need to change that. That's something nobody can ever plan in. That's only going to come up in a semi-structured conversation when experts share. So that's
Right.
great.
Remind everyone that there is still time to type in questions if you have any. One question we've gotten is, so if this is the first time you've really thought about preventing, preventable human errors, what's the biggest challenge in your opinion on how to get started?
That's a great question. Yeah, thank you for the question. Keep it practical. One of the biggest problems or challenges people face is there's no one roadmap or path to take. Um, for example, there's no one certification you can go and get in human errors that's nationally recognized. It doesn't exist. There's lots of little ones that have pros and cons, but there's no one real path to take. So if you're interested, if you're inspired a little bit to go, I like this and I'm interested, but I don't know what to do with it. Here's what I would say do. Um, Go download the Department of Energy books. One, they're free, right? I mean, it's easy. You can go and do it. They're not the easiest read. They do not read like a thriller novel by Dan Brown or Michael Crichton. They're kind of tough to read, but there's a lot of good stuff in it. So I would say read it like an encyclopedia and just flip to the table of contents. Find stuff that interests you and just read little bits. And once you get something that you think is useful to you, try something really simple, like three-step communication, right? And then don't just keep reading, but learn about it, maybe look it up 2 or 3 other places on the net, and then say, okay, let's try it out. And actually do a little experiment for, 7 days, something like that, with you and one other person, and just say, let's try doing this three-way communication for 7 days, and at the end, assess and see. And if it works, great, figure out why it works and then try something else, keep it bigger and better. And if it doesn't work, kind of debrief and go, okay, what could we have done differently? Things like that. That's the best way I can say to get started is try it out on your own. Find some good resources. Again, I'd recommend you get the HPI field guide. I think that's a lot easier read than the DOE manuals. And that's I think a good way to start. And once you get into it a little bit more, either email me or you can see some of the more advanced books to go. But I'd start with the DOE manuals.
Thank you so much. That's a great answer. So if you're getting started, do you go solo? Can you build a team? And if you're going to build a team, who are some of the people you might recommend to get involved in this type of a program?
So who are some of the people that I might recommend to get involved? I'm not
Yes.
sure what my options are on that. If you're talking about like senior leaders versus individual contributors, are you talking people in HR, training, safety,
Right. Yeah,
things like
I think just kind of like what are some people who might be able to give insight or help get something like this started? And I would think HR would be a good place to start.
that? HR has their own kind of mission. I have presented and worked with HR people before on one particular concept called the just culture, and we didn't get into it here, we didn't have time, but it's the idea of basically don't punish people for making mistakes. A guy named Lucian Leap, who was head of the Harvard School of Public Health, testified before Congress when the first numbers on medical deaths started coming out. Congress said, why are we killing so many people inadvertently? Dr. Leap, what do we do about this? And he said the single biggest thing you can do to reduce errors in healthcare is stop punishing people for making mistakes. He didn't say hold people more accountable. He didn't say we need more procedures. He said when people when you are convinced that people are actually trying their best or making every reasonable effort to do the right thing, even if they screw up, even if they wind up killing somebody, do not punish them or sanction them in any way because they were already trying your best. You can't punish your way to excellence. And when you do punish somebody for making an error, what they tend to do is shut up and not tell you anything more. That's the relationship that HR gets into, and that's useful to get in HR with that. But I guess I would say start with your safety people. I'd maybe start with a 50-50 mix of safety and operations. I might even probably actually, yeah, I would probably go about 60 or 70% operations because they're going to be the experts that understand how things get done, and maybe a few safety people in there. Um, in terms of getting started, it's got to start with you. You've got to start practicing and embodying and modeling these techniques before you ask anybody else to do them. If you don't do that, if you basically say, do what I say and not what I do, it's going to be failure to begin with. You got to model it, and then just people will watch what you're doing and see it, and then you say, just do what I do. And if they like you and respect you, and if you're a good leader, they'll do it, and you won't need to do much training at all. Does
Right.
that make sense at all?
It does. It does. And this question is probably goes in with what you just said. Someone asked, what is the strategy to shape the culture of multiple sites
Uh-huh.
toward error prevention?
Thanks for the easy question, folks. Appreciate that. Okay, so multiple sites. Here's what I have done. So the short answer for that is you can go top down or bottom up. You can basically, and a lot of companies have basically said, all right, we're going to do this human performance thing, and they get a strategic planning team together. They write a 50-page strategic document and say, we're going to do one tool a month, rolled out to the workforce. We're going to do trainings, posters, all this stuff, and it's going to be top down, and we're going to, enforce the use. I have not had good experiences with that. Because of the nature of human performance, trying to get people to make fewer errors is really hard to enforce and make into a top-down program that's been successful. I won't say it's never successful because I don't know everything, but what I've had a lot more success with is every office, every team needs something slightly different. For example, the linemen and women who work up on the 300-foot towers, they need a different approach and slightly different tools and techniques than, for example, system operators who sit in an office all day on a live system, turning on and turning off substations, right? You wouldn't give them the same tools, the same program, the same philosophies necessarily. So what I do is work with, first kind of establish a beachhead of expertise. You might call it an island of expertise. Um, you might call, and this is a good term to Google too, community of practice. A community of practice is you plus 2 or 3 or 4 other people who are passionate, curious, interested, and are interested in developing some skill in this area. And that becomes your community of practice that you connect with on a regular basis, do conference calls with on a regular basis. And as you all try different experiments, hey, let's try 3-way communication. You're naturally going to connect with a few trusted, hand-picked people in each one of your realms. Hey, Bob, can you talk to Billy, who's over in your office? I think he really seems like he's getting into this. And Bob goes, yeah, he really kind of is. Great. So instead of forcing the whole office to take it, just see if you can get Billy engaged and involved in it. And if it works, right, in that small office with Billy and Bob, then other people are going to see it and kind of go, what are you guys doing? And they'll be curious. And if it's good and coming for the right reasons, they will want to learn more about it, right? Instead of you forcing it down their throat. It takes longer to do it that bottom up grassroots way, but I found that it has a lot bigger effect, a lot more positive effect. I don't know if I answered your question or not. That was a big, tough question. Did I give you anything resembling a useful answer on that?
I think you did. I think you did. And he has your email if he needs to reach out and ask some more questions. I think we have time for one more.
Okay.
And it is, hold on just a minute. Um, do you have recommendations for how to push cultural shifts in an organization before a watershed moment? In other words, how do you convince someone fire is hot if they've never been burned?
Hmm.
Another easy one.
No, you're asking great questions. The short, brief, cynical answer that I can give to that is you don't. What you do instead is prep your argument. Um, you get ready to make your argument, and then you wait for what us educators would call a teachable moment. If you have, let me put it to you this way. If you have kids, you may know what this is about. I have a 12-year-old daughter and a 9-year-old son, and trying to teach them things like self-sacrifice, persistence, grit, things like that. If I do it at the wrong time, right, when they're not ready for it, it's going to be like water off a duck's back. They're going to go, yeah, Dad, thanks. And they're going to be respectful and go, I got it. Yeah, that makes sense. Thanks, Dad. But if I sense that I know what the next lesson is that I want to teach them and what they're ready for in the next 6 months or something like that, and I wait, I kind of keep my powder dry and I wait for the right moment. I wait for them to fail at a soccer game or not get the audition on the play, and they come back and I can see in their faces they're like, I don't know what happened and I don't know what to do. Then there is a moment, and it may be a few minutes, it may be a few seconds, when you can use your argument or use your kind of pre-planned thing. That's the right time. So much of what I found about changing culture and changing hearts and minds is not about using more force. It's about getting the right timing and using as little force as possible. That's kind of an abstract answer. There's a lot more to it, but that's kind of what we got in terms of the time. I hope that was helpful for you, at least a little bit.
Yeah, I think it probably will be. And we actually have time for one more, and this will be the last question.
Okay.
Someone
Awesome.
suggested you fight how you train and that simulation is the best form of training. Do you think this is true? And is this a good strategy for preventing errors?
So that's again another good question. Is simulation the best strategy? Just speaking from a training point of view, the closer that we can get people to model and practice and simulate the decision making that they use in the field, the more accurate that it's going to be, right? It's we call it a high fidelity simulation. Um, for example, in teaching EMTs, emergency medical technicians, they used to just have a classroom, and then we're going to do a few demos on dummies, plastic dummies, mannequins. Now they have the mannequins which bleed, which you can stick needles into, which you can shock with a defibrillator and see what happens. The simulations have gone extremely high tech and high fidelity, and it's producing a lot better paramedics. So yeah, simulations make a big difference. Um, but what I would say is go back to the third strategy of resilience. If the only thing you simulate is the way that things should go on a bluebird day when everything's perfect, I think you're setting yourself up for failure. You do want to practice the way things should go, but to be resilient, you also want to practice things going wrong. Example, in a flight simulator, you want to push the button that says, okay, let's give somebody a false indicator light on a engine fire on engine number 2 and see what they do with it. You got to practice simulating things going wrong to build resilience.
That is a great way to end and a great answer. And I want to thank everyone for joining us today. Most of all, Dr. Jake, thank you so much.
My pleasure.
This concludes our presentation. Please hang out for a minute and answer the survey at the end of the webinar. And thank you again for joining us, and hope you all have a very great day.
Take care, y'all. Stay safe.